Hi everyone, this is the Health Psychology Lecture. The objectives of this lecture are to understand what health psychology and its subfields are, the importance of the biopsychosocial model and the stages of change model, and the effects of stress. Health psychology is a subfield of psychology concerned with how behavioral, social, and cognitive factors influence the causes and treatment of physical illness and the maintenance of health. Sickness and health are not merely features of the physical body. Physical health can be stemmed from psychological issues or affect psychology. Perceptions of illness can affect the course of the physical illness or other health problems. Within health psychology, there's pediatric psychology, which is a specialty field within the context of pediatric health. The field of pediatric psychology aims to promote the health and development of children, adolescents, and their families. Behavioral medicine is another subfield within health psychology that is interdisciplinary, that focuses on developing and integrating behavioral and biomedical knowledge to promote health and reduce illness. It is how behavioral, social, and biomedical factors relate to health and physical illness. Prior to the biopsychosocial model, there was the biomedical model, which was the original model of illness and laid the foundation for how illnesses were conceptualized and treated in Western medicine. The biomedical model states that illnesses are caused by a pathogen, biological deficit, or infectious disease. Therefore, treatment would often be medications. Whereas the biopsychosocial model incorporates mental and physical health in order to focus more on environmental, social, and behavioral factors in health. The biopsychosocial model promotes interdisciplinary teams and patient-centered care to focus on concerns of patient functioning, quality of life, and cultural factors that may affect overall health. Here is a graph displaying psychological, biological, and sociological factors that can be incorporated into the biopsychosocial model. Health behaviors include any activity undertaken for the purpose of preventing or detecting disease or for improving health and well-being. Some examples are eating right, exercising, brushing your teeth, drinking in moderation, and practicing safe sex. Here is a graph explaining a current health crisis in the U.S., and it shows the effects of health behaviors on our society and how important health behaviors are. As you can see in the graph, the lowest levels of obesity in youth is in the age range of 2 to 5 years, whereas the greatest levels of obesity are in the range of 12 to 19 years of age. This is a major health concern for our youth, as you can see that in the 12 to 19 years of age, that 20% are considered obese. The Stages of Change model describes the process in which individuals give up bad habits and adopt healthier lifestyles and ultimately change a behavior. It is comprised of 4 stages: the pre-contemplation stage, the contemplation stage, the preparation/determination stage, the action/willpower stage, and the maintenance stage. The pre-contemplation stage is when people are not genuinely thinking about changing. They may not even realize they have a problem. People in this stage commonly deny that there even is a problem. So, for our example, in the pre-contemplation stage, Susie is overweight and she's unaware that she has a weight problem. The next stage is the contemplation stage. This is when people acknowledge that they have a problem and begin thinking about change, but may not be ready for change. Along with our example of Susie, She knows she should lose weight, but she is not sure if she's ready to commit to a new diet and physical activity plan. So she's starting to think about it. In the preparation and determination stage, the person starts planning or coming up with steps to start taking action. So, back to our example, Susie starts actively looking for an exercise program she can do to lose weight. So, Susie starts looking at Weight Watchers and maybe joins the Colvin. The next stage is the action/willpower stage. So now the person is doing the new behavior or engages in the behavior change. So Susie starts a diet or exercise program. The last stage is the maintenance stage. So people are successful in continuing their behavior change over time. Some factors that help with successful change and maintenance include social support and reinforcers. Also, an important factor in the maintenance stage is trying not to return to relapse. A relapse is a return to a former unhealthy behavioral pattern. So, for our example, Susie sticks to her diet and exercise program for 6 months. A key aspect of health is stress. Stress affects the automatic nervous system, state of consciousness, emotions, your immune system, and personality. Stress is the process by which we perceive and respond to certain events that are called stressors. Stressors are things we view as threatening or challenging, and they can place demands on a person. Stress can cause a lot of wear and tear on the body. This happens even with good stress, such as getting married or having children or starting a new job. Chronic stress is stress that occurs continuously or repeatedly. After major life events, people often tend to get sick. One study found that the more stressful major life events you have, the more likely you are to have future illness. For example, a person who is divorced and loses a job and has a friend die all in a year is more likely to get sick than one who just had a divorce in a year. Chronic stress affects many parts of the body, including the brain, the cardiovascular system, joints and muscles, skin, the gut, and the reproductive system, as shown in this diagram. It also affects the immune system. The immune system is remarkably responsive to the psychological influences. Stressors can cause hormones known as glucocorticosteroids to flood the brain, wearing down the immune system and making it less able to fight invaders. For example, in one study, medical student volunteers agreed to receive small wounds to the roof of their mouth, and researchers observed that these wounds healed slower during exam periods than during summer vacation. In another study, a set of healthy volunteers allowed researchers to swab common cold viruses into their nose, and the participants who were considered stressed, so those who had lost a job or were having issues with family members or friends, were more susceptible to the virus than those who reported brief stressors, such as those lasting less than a month.